Most women feel nervous about this test, but this simple procedure can detect cervical cancer before symptoms even begin. What is pap smear? A pap smear is a screening test used to check for abnormal cells in the cervix, the lower part of the uterus. Detecting them early can prevent cervical cancer before it becomes dangerous. Before the test. Before the procedure, the patient lies comfortably on the examination table while the doctor prepares the instruments. Speculum insertion. A medical instrument called a speculum is gently inserted to allow the cervix to become visible. Cell collection. The doctor then uses a small soft brush to collect cells from the cervix. The process usually takes only a few seconds. What do the results mean? Most results are normal, but if abnormal cells are found, additional tests may be needed to prevent future complications. Does it hurt? Many women feel mild discomfort or pressure during the test, but it is usually quick and not severely painful. Who should get tested? Regular screening is recommended for women because early detection greatly improves treatment outcomes. Resolution. Understanding how this test works can reduce fear and help protect long-term reproductive health. Subscribe Medical Officer Pro for more health information.